Okay, so let's talk about cerebral autosomal dominant arteriopathy with subcortical infarct and leukoencephalopathy, which is an inherited disorder caused by mutation in the Notch3. Now, manifestation includes recurrent stroke, recurrent TIA, migraine, subcortical dementia, subpulvar palsy. It's all about small vessel arteriopathy. That is the cause of this disease based on the Notch3 mutation. You can see the result mutation on chromosome this and this involving the Notch3. Again, this is the stem of the disease. And again, clinically, the patient present with TIAs, with strokes. Now, the areas that are usually involved in those patients are the subcortical area in the white matter, basal ganglia. Migraine are common in those patients, and usually or eventually it may lead to dementia. Now you can see that an angiopathy of small and middle-sized arteries is characteristic without atherosclerotic or miliary deposition. Now we need diagnosis. For diagnosis, you need genetic identification of the Notch3 gene mutation. Now on MRI, what you can see is something that is quite similar to PRESS with symmetric T2 hyperintense lesions, but usually the lesions are in the basal ganglia, thalamus, and pons, and they are more commonly anterior in location compared to PRESS, which are more in the posterior circulation. Now, treatment, no cure, but you need to relieve symptoms. Now, let's see some imaging. You can see it's in the anterior part of the temporal lobe compared to PRESS, and it should be symmetrical, so you see the symmetrical lesions. Again, more commonly in the anterior part compared to PRESS, which is more commonly in the posterior part, also symmetrical. So you see those T2 prolongation or T2 hyperintense lesions or on flare and on other things. There is the differential diagnosis with multifocal dementia, with progressive multifocal leukoencephalopathy, PML, HIV encephalopathy. But here we are talking about anterior part, symmetrical lesion with infestation. We said diagnosis needs to include a genetic Notch3 mutation. Thank you very much. This was about CADASIL or cerebral autosomal dominant arteriopathy with subcortical infarct and leukoencephalopathy. Thank you very much, and thanks for the opinion. That's it.